Thank you all for joining. The webinar will begin at noon. Thank you for joining. The webinar will begin in 1 minute.
All right, I think we're ready to get started with today's webinar. Hi, everyone. Welcome to the Bend Chamber of Commerce Impact webinar. Today, we're talking about the state of our health, from everything from what the current restrictions are, all the way to state of our hospitals and the COVID cases, and also a little bit of information on the great news of upcoming distribution of vaccines over the coming months. So we have a lot to talk about today. We have two guests with us today. We have Emily Freeland, who is a Deschutes County health specialist, and also joining us today, Dr. Dean Seidenlinger. He is our state health officer. You've probably seen him on a lot of the governor's press conferences, and we're very grateful for his time today. There is a lot going on out there, and I know there's a lot of fatigue over how COVID has impacted us, especially around the holidays. We hope this is valuable information to you that'll explain the situation and also give you information and I'm hoping a little bit of hope by the end of it. Before we get started today, there are a couple of things I'd like to share with you. By the way, I'm Katie Brooks, CEO of the Bend Chamber. Every year, the Bend Chamber does a SAGE Awards, and usually these are business awards to the best largest business, the best small business, Citizen of the Year, Lifetime Achievement, that sort of thing. We decided to do something very differently this year and celebrate stories of resilience instead. There are thousands of them out there. And over the course of the next several weeks, starting with next week on the 17th of December, we'll be sharing videos with you all of stories of businesses in our community that have somehow struggled through, been innovative, and figured out a way to keep going, even in the hardest of times. And we want to share these stories with you as a gift of hope and resilience as we push through these final months of getting this virus out of our community. So join us and watch for the release of those videos, and you can see them on the Bend Chamber website at bendchamber.org. Also, just 2 minutes ago now, the COIC website was closed down for applications for the final amount of the CARES Act funding that came from the state. We hope those of you who applied, we wish you luck. There are teams across the region that are putting together an evaluation process, and hopefully that will get more checks into the hands. I think there's 2.2 million that's going out to Deschutes County alone. Hopefully those checks will be reaching you before the end of the year. And finally, before we move on in our program, just a gentle reminder to all of you to please shop local this year. And it's more important than in any year before that you do as much as you can and spend as much as you can in your own community. I know it's not possible for everything, but we would sure appreciate it, and so would the businesses here in Bend. So with that, I want to get into some housekeeping. So we usually get a pretty high volume of questions. I think today is going to be very much that way. So we're going to take them as best we can and ask them as we go, and apologies in advance if we're not able to get to yours. Please place your questions in the Q&A button on your screen rather than the chat button. We ask questions from Q&A, not the chat. And all slides and a recording of this webinar will be provided after it's all done, so you don't have to worry about taking screenshots or notes. We'll be able to provide that to you later. All right, so the first thing we're going to do today is talk with Emily Freeland. She's the environmental health specialist for Deschutes County, and she's going to share with us some information that will update us on the current COVID counts, trends, and hospitalizations, and some important information from the the DCPH. And I think that'll be a lot of really good information that'll give you some context of really what's going on here in Deschutes County and what we can do to help get COVID numbers down. And so with that, Emily, I'm going to let you take it over.
Thanks so much, Katie. I so appreciate being able to be here, and I hope that our information is helpful. I'm just going to share my screen real quick here. Weekly we do an update. Usually George Conway, or our Director of Public Health, Nahad, does an update with the Board of Commissioners that has this information. So if you guys are looking for this information on a more regular basis, you can certainly tune into that. It's always available on Facebook Live on Wednesdays typically. So this is just an update of where we are with our numbers locally. And then I'm going to just also talk a little bit about the questions and kind of concerns that I'm getting when I'm talking to businesses every day that are getting positive cases, and just some of those quick update on some of those trends. So this first chart shows our cumulative cases basically since the beginning of the pandemic when we were tracking these numbers. So you can see that we have seen a spike in cases, kind of the rate at which the line is changing, so how steep it is after pretty much every holiday. So you can see after 4th of July, we saw a little uptick. Labor Day, there was another one, and then our most recent one is Halloween. And you can see that line is just getting a little bit steeper and steeper as we go on, which really makes sense. The more cases that you have in your community, the more contagion is out there, and the more difficult it is to stop. So as we are going past Thanksgiving, we probably have not seen the full repercussions of what those numbers are around Thanksgiving, but hopefully all these behavioral changes that we're asking all of you to make, and all these sacrifices that we're both making in our businesses and our personal lives, and those choices that we're making, we'll see kind of the flattening of this curve, as people would say. So this chart here shows our cases by week, and you can see at the beginning we just had a couple cases here and there, and as we've moved on, and the last couple of weeks we've had 455 and 456 cases. So this is, as you obviously can tell, a huge significant increase from the weeks previous to that. And it's really changed where we've stood, both with our reopening of schools and this new metrics that Dr. Seidlinger will be going over on how businesses are affected. So no longer in that kind of phase 1, phase 2 reopening guidelines, but a different way of looking at things based on the numbers that we're seeing in each county. This is putting a significant strain on our staff, the people that I work with every day, and how we're doing contact tracing. So the more cases we have, the harder that is to do a very thorough job and collect a lot of information. This chart shows a little bit about the cases by age group. So you can see here that 20 to 29 is the highest number of cases that we have in our county. It's about 20% of our cases are that age group there. But between 20 and 59 is about 2/3 of our cases. So a lot of cases in that middle range age group, and we're seeing this spread significantly there. Maybe not as severe of illness, but certainly lots of cases. This chart is the last week of data that we have. So we look at 1 week increments of data, and it shows of that 456 cases that we had last week, what the breakdown and demographics of that age group is. So again, 20 to 29, we're still seeing the greatest number of cases in that age group. And then of course, more cases between the 30 to 59 age range. But a lot of questions we get around is if any kids are getting sick, and you can see here, even in the last week, we had 16 in the 0 to 9, and then 44 additional cases in that 10 to 19 range, which again is why we're seeing some of those local decisions. Like probably most people heard that Redmond School District decided yesterday to go ahead and stop doing the limited in-person instruction, which they were doing. So that was, I think, a really hard decision because everybody wants those kids in school and getting that in-person education, but the number of, what we can do. So shows the number of tests. So basically, individual record. So, and that better accurately captures how many cases or how many tests are being administered. So this is not by patient. So if I went and got 2 tests a couple days apart, then that would show up as those 2 tests on this chart. So gone up significantly.
So Emily,
from,
this is Katie.
October till now, they've pretty much done being administered.
Your sound is not
Katie, can you hear me?
right. Yeah, your sound is not quite working right. You may want to go a little slower just so we can keep up.
Okay. Okay, let's see. Can you hear me now?
Yes.
Okay. So like I was saying, I'm sorry about the connection issue. Hopefully that fixes itself somehow. But As you can see here, our number of tests is going up significantly from what we were seeing in September and October, but our positivity rate, so that's that small blue bar, the number of positive cases are also going up. We have seen positivity in the last few weeks double what it was at the beginning of November. So if you look at the beginning of November, we were around 4% positive test rate. And now we're seeing right around 7.2. And then last week, the week before that, we were at 9. So some high positivity rates as well. So this is the metrics that we look at both for reopening data and for school reopening. And you can see that, again, we're in this red zone. So this is this extreme risk zone, or for schools where we would want to implement comprehensive distance learning, which I mentioned some schools have already moved over to that. So we're not just on the border as we were at the beginning of November, where we were seeing about 233 cases per 100,000 people per 2 weeks. Now we're up almost to 500 cases per 100,000 per 2 week period. So again, hopefully we're going to see some leveling off by all of these changes that we're making in the way that we're doing things, but our numbers are still going up pretty significantly. Again, the positivity rate here we see we were down at 4.5 and now we're at 8.1 for the last week of data that's on here. And then the last thing we want to mention or talk about is those numbers in St. Charles Health System. So this is not just Deschutes County residents, but it's everyone who may be in the St. Charles Health System data. But you can see that the number of patients, COVID patients that they're seeing is going up very, very significantly in the last couple of weeks. I think today's number, there were 39 COVID patients. And that's a major problem, right? Because what we want is, although many people get a not very severe illness, the few people that do get really sick, we want them to be able to access the care that they need. And if we don't have those beds available or those places for people to go when they're getting very sick, then it's a big significant concern. And I think that that's what we've been trying to protect this whole time. So we want to make sure that the sacrifices that we're making, personal sacrifices and business sacrifices are borne out, and we are able to keep those numbers low enough that people can get that care when they need it. So again, I've said this stuff many times, but I'm going to say it again, and it's really important for every business to make a plan. So if you have a positive employee, do you have a plan about what happens next? And do you know who to call, how to assess risk with that positive employee, how to contact all those employees that may have been affected, and what your legal responsibilities are. Due to the surge in cases, we are not contacting every single case within 24 hours. So while people are waiting a call from public health, it is important that they notify their employer. And if you have questions, you can reach out to us. And we have this new webpage that helps kind of guide people through that. We also have this flow chart. I don't expect people to be able to read through all the information on this, but it will be available to you. That kind of helps you know what to do when you have a positive employee and how to contact us, either the communicable disease line or myself, to help walk you through that. So I would certainly hope that most people can look through this and really work on that plan, because it makes a big difference when you do get a case. And I would say not if you get a case, but when you have a case in your staff, how are you going to handle that? When they went back and looked at it, they understand that not everyone is following those rules. So, verification of training is basically what a health inspector does. And if that was something that we only had to train people on once, we wouldn't have jobs, because we wouldn't need to go into restaurants every 6 months and make sure that people were doing the right thing. And that's what you can do as a business owner is if you have break rooms, if you have these, processes that you have in place, you need to verify that the employees are still following those. Because like Katie said, we are all in pandemic fatigue. We are tired of following these rules and nothing bad has happened so far. So why does it matter that we continue to follow these rules? I feel like there's a lot of people that I talk to and they say, I thought no one was sitting in the break room at lunchtime and eating together. But when I had a positive case and I started asking questions, I found out that they were. And then we had many cases because of that. I would also mention it's really important to screen for symptoms and that fever is not the only important symptom to think about. So you can see from this data here, we're seeing about 30% of our positive cases in Oregon report a fever. So a fever is important, but it's not the only important symptom to look at when you're thinking about people staying home from work or working while they're sick. Please, please, please send employees home if they're not feeling well. And then behave as if you're contagious now, because we have this pre-symptomatic and asymptomatic transmission. If we can do all of those things and pretend we're contagious now, how would we behave and do that? So that's basically what I have. And I'll turn it over to Katie, who can hopefully
Great. Thanks, Emily.
pass it on to Dr. Seidlinger. Thank you.
So one thing that I've noticed from your presentation and from a lot of the conversations that have been happening is the vigilance in wearing masks, distancing, and washing hands. We've heard it a bazillion times, and I know that there is a lot of fatigue again out there in the community, but please do these things. And Emily knows what she's talking about. I do have some stats from the hospitals that 67 in Region 7, which is includes Deschutes, Crook, and Jefferson counties, I believe. 67 are hospitalized right now with COVID-19. 15 of them are in ICU, and 7 of them are on ventilators. This is today's data that was shared to me by the governor's regional office. Hospital capacity status, 7 ICU beds are available in the region, 7. And why that matters is because if there's a car accident, if somebody has a stroke, if something happens, you always have to have a certain amount of open beds. And I know it doesn't make a lot of sense if you think, oh, there's 7 beds more. It's that one event that can change 7 to 0. And then what do we do when we run out? And I know it's a tough thing to grasp, but it's something we all have to get our heads around and push these final months in order to help our region, and not just people who get COVID, but people who get in accidents or any other type of incident, the healthcare that they need, and stick together as a community. And so with that, I'm going to move on to our next guest. Dr. Dean Seidlinger is our state health officer, and he's the state epidemiologist. He's been with Governor Brown on many of her press conferences as giving sage advice and insights on what's happening health-wise in our state. And Dr. Seidlinger, we are so thrilled to have you here today to share with us your insights on what's happening with this virus in our state, what the restrictions will do to help bring those numbers back down, and then maybe a little bit of insight on what the distribution of the vaccines will look like. So I'm going to go ahead and hand it over to you.
Thank you, Katie, and thank you, Emily, for setting this up so well. And thank you all for being here. I'm going to share my screen. I put a couple of websites in the chat box. The OHA coronavirus update, which is a good place to get statewide data. Emily showed you where to get some great data locally for Deschutes County. The governor's office website, which has a lot of information, particularly on our risk factors, our risk levels, and the guidance. There's some links there, and a link to our coronavirus vaccine website from OHA, and I'll show you some of those as we talk through. But let me start with a thank you. One, thank you for having me and this opportunity to talk, but also thank you for the continued partnership. We know that the sacrifices that we've made in our personal lives and not being able to gather socially for those of us who have relatives who may be in a skilled nursing facility or loved ones that we've not been able to visit. The economic impacts on ourselves as business owners and on your employees, have been great. This pandemic certainly has not left any part of our state untouched, from the economy, physical health, and mental health. It's had some disproportionate impacts with some communities, some counties, seeing increases in cases at different times. Right now, we're seeing increases in cases across the state, but some of our neighbors have been disproportionately impacted. Our Pacific Islander community especially has had the highest rates here in Oregon, followed by our Latinx neighbors, our Black, African-American, African immigrant neighbors, and certainly our Native American neighbors here in the state have had COVID rates higher than others. That's not because of genetic differences. I'll go back and tie it a little bit into the data Emily showed about age ranges of cases. We know that those, age ranges 20 to 29 and 30 to 39 are the highest. That's not all social get-togethers and parties and other things. So that is contributing there, as is in other factors. But that 20 to 59-year-old range she showed are our primary workforce. People are out and working who have continued to work throughout this pandemic, whether they're in healthcare, long-term care facilities, our retail partners, restaurant partners, and others, delivery folks, and our food system folks, whether our migrant and seasonal farm workers and others that have continued to work. And so their exposures are higher, and that's why we see them overrepresented. So I want to thank you for those sacrifices, for continuing to work with us, and for the opportunity to have this dialogue. Having a vaccine, which we're going to finish this conversation with some vaccine planning, arriving in the state shortly is great news. But the measures we have in place now, wearing a mask, limiting our gathering sizes, are going to be with us throughout the winter, spring, and into the summer. We use kind of a Swiss cheese approach where we layer on multiple layers of protection. Each one of them is not in and of itself sufficient, but when used together can do better. So I'll start with, this is off the Oregon Health Authority website, our daily curve. I show the EPI curve. This is our cases, our individuals with COVID plotted by the date of their symptom onset, or for those without symptoms from 2 days before they got tested. As you can see, we did see an increase through the summer after reopening. We did see some increases, some spikes after each holiday. This is the week that we would anticipate seeing increase in cases coming from Thanksgiving. We've not yet seen a huge increase in cases, but we'll know more at the end of the week if we're seeing those cases. And then we anticipate some additional cases from Hanukkah, Christmas, New Year's, which round out our end of the year holidays. So cases have definitely risen fairly steeply. This area that's shaded, we can't be, we are still getting in cases. So we're not out of the woods. We haven't flattened yet, but we're hoping that this flattens. We talked about hospital capacity. You heard from Katie the importance of hospital bed. So we have folks in the hospital for COVID. We have folks in the hospital for other reasons, and so those take up people in beds. But we know our hospital staff, much like many of your staff, have also been impacted directly by COVID and maybe home isolating or quarantined because of exposure, often in the community. It's not usually in the healthcare setting itself, where there's pretty good use of personal protective equipment, and that personal protective equipment is better available now. So this is maybe a little flattening of the folks who are in the hospital with COVID across the state. This middle line is our ICU beds and our folks who are on ventilators. So maybe a little flattening over the last few days, but still not out of the woods. Our hospital capacity is constrained. So based on that, and knowing that we want those hospital beds to be available for everyone, the quality care that you deserve if you have COVID, if you have a heart attack, if you're involved in a motor vehicle crash, we want that to be there for everyone. And that's why we're making these sacrifices. We know that older individuals, those with underlying conditions, are more likely to have complications. But unfortunately, we've seen healthy young adults and children without underlying conditions who've been hospitalized and tragically died. So we can't predict how this virus is going to impact everybody. The things that make this virus hard to control with our traditional public health tools of public health investigation, keeping people home when they're sick, isolating them, quarantining those around them who were exposed so that we would limit the spread, is the fact that this disease doesn't cause symptoms in about half of people who have it. So they feel just fine and they can be out in the community, but still spread the disease. Even those who do develop symptoms are most contagious from the 2 days before their symptoms start until about 5 days after their symptoms start. So again, they may be out in the community, not know they have the disease, and can spread it to others. It spreads very easily without some of our mask requirements or physical distancing. It's much more contagious than our typical influenza and other winter respiratory viruses. It also causes more complications and a higher death rate than our seasonal flu typically does. So putting those things together, we need to use additional tools to control that. And so that's why we've moved to some of these community mitigation measures about limiting gathering sizes, especially in settings where transmission of the virus is easier. So with that, I'm going to go to the governor's office website and talk about how we propose to kind of live with this virus through the winter as we get towards vaccination. We're hoping that we can get the control of the surge we're currently seeing, have cases decrease so that public health is better able to do more thorough investigations and try and keep as many people home who are contagious or potentially contagious, and start adding some activities back. We know that with vaccination of a significant number of people, we're going to see very decreased transmission. We'll talk about vaccine again at the end, but that's going to take a while. So the new risk levels that the governor announced before Thanksgiving, how we came out of the freeze, are based on our school metrics and are based on limiting activities when cases counts are highest in settings where transmission is easiest. We base this on data we've seen in Oregon with transmission, as well as data we've seen from other communities with similar measures in place, as well as what we know about transmission of the virus. We use multiple studies, whether it's case studies of particular outbreaks, to even some of the data we have on mobility using cell phones and spending on credit cards after reopening. What I will say is that the governor's pause and then freeze, I think, did have some impact, and the adherence to those orders that people took really made a difference. We saw decreased mobility across almost every measure in the week leading up to Thanksgiving. We saw in a national survey broken down by state that Oregonians were amongst the folks who are most likely to say they were going to spend Thanksgiving only with members of their own household. Traffic through Portland International Airport was at about a third of what it was last Thanksgiving. That's compared to most other major airports that saw traffic increase to about half of what it was. So Oregonians are listening, are making the sacrifices. You feel it in your own lives from the sacrifices you made, but definitely on the economic front. But this is a for now piece, not a forever piece. And we are hoping that some of the grants that Katie said would be coming out to you will be awarded soon, and we'll go towards filling up part of that gap, and that we get additional resources that come in to allow us to mitigate some of these economic impacts that we're having. So that being said, let me walk through this risk framework a little bit. On the right is extreme risks. This is cases in Bend or in Deschutes above 200 per 100,000 over the previous 2 weeks, or a percent positivity of 10% or above, gradually moving down to cases in the lowest risk of less than 50 per 100,000 over that same period, or a percent positivity of less than 5%. While there are 4 levels here and similar colors to what our neighbors in California have, their risk levels are written at about half of the spread of our risk levels. So they allow about half the spread of disease before they implement similar measures. And lately, this week, with the increase in ICU bed usage, they've moved into a stay-at-home order across much of the state. Regions in California are significantly more populous than the whole state of Oregon, and so it definitely has an impact with 33, I think, million people impacted by the new stay-at-home order in California. So bars and restaurants, eating and drinking establishments. Unfortunately, in those establishments, we lose a couple of the tools we typically have to prevent the spread of disease. People can't wear masks while they eat or drink. And often they remove their masks while they continue to talk to their friends and family or sitting at the table with them. So we do recommend that people keep on their masks when they're not eating and drinking, particularly when the server comes up to the table, but we know it's not possible for them to keep their mask on all the time. When people get together with their friends and family members from outside of their household, they're seated within 6 feet of each other, and that can promote the spread. What's different from the freeze to here, as the framework that we will have with us throughout the winter, is that we have allowed a level of outdoor dining. Outdoor dining with increased circulation can certainly mitigate the spread, even without masks and with that close physical distancing. There is still a risk in these settings of transmission. Also, outdoor structures do make a difference. The guidelines say that at least 75% of wall space should be open. That'll promote airflow. We know that a ceiling, roof overhead can be very important in our winter climate, and definitely providing heating and other other opportunities to make it more comfortable, but trying to keep 75% of those spaces open. As case numbers go down, bars and restaurants are allowed more capacity with the addition of indoor capacity as case rates go down into the high-risk setting. For faith institutions, including funeral homes, mortuaries, and cemeteries, allowing a level of indoor capacity that matches what our neighbors to the north have in Washington. We know that with measures in place, strong physical distancing, using masks at all time, and limiting singing, we can see limited spread in these settings. Though unfortunately, in many settings that haven't been following the rules, we have seen outbreaks. And even in some faith institutions that have been following the rules, we've seen some outbreaks. So there's allowance for more people outdoors and indoors, and capacity gradually increases. Hiking and camping, being in the great outdoors with a couple of friends is allowed. We've broken up indoor and outdoor activities because we'll go over indoor first. Indoor shopping malls and shopping was at 75% during the freeze. That's been decreased to 50% in the highest spread counties, increasing to 75%. The exposures in retail settings tend to be very different than bars, restaurants, churches, or some of these other entertainment establishments. People tend to have fleeting contact with others, don't spend as much time in those settings typically, and are wearing their masks the entire time they're there. For indoor entertainment establishments and indoor recreation and fitness centers, those activities are prohibited in the counties with the most spread, and gradually add capacity indoors as case rates go down. In these settings, particularly in recreation and fitness centers, what we know about spread is that people when they're exercising or breathing heavier, that can spread the virus further. And as they're exercising heavily, if they sweat, that sweat can dampen their mask, which makes their mask less effective, can make the mask harder to breathe through, and that's when people are more likely to take it off as well. And that's why these activities have been moved outdoors in the highest spread counties. Indoor entertainment facilities, whether that's theaters or other gathering places, people tend to spend more time near the same people for a longer period of time, and that's why they're treated differently than, for example, retail above. For long-term care facility residents, we know that the limitation on visits, the changes in that visitation policy have had tremendous impacts on the residents and their family and loved ones outside of the facilities. Just before the surge, we started adding back the opportunity for indoor visitation, and those have been curtailed in those counties with the highest spread and moved to outside only. Movement inside is allowed as case rates go down. For offices, requiring remote work if able, and closing offices to the public in the highest spread counties, we're recommending remote work as cases go down. For professional services, some medical services and other social services that require that face-to-face contact, that is allowed, but we ask that it be limited as much as possible and move to a virtual setting, if at all possible, without significant members of the public in the office. Outdoor entertainment and outdoor recreation kind of mirror indoor in terms of the types of settings, but add a capacity for doing that outdoors, similar to bars and restaurants and other eating establishments. Allowed up to 50 people in the counties with the highest spread and gradually increasing. The reason these outdoor facilities don't go to 1,000 or 2,000, even in that green spread, is that often in these facilities, there's some constraints on ingress, egress, shared indoor services like bathrooms or concessions or other things. And so limiting the capacity to 300 until we can drive these case rates down, hopefully through the use of vaccines. For personal services, haircuts, tattoos, non-medical massage and therapies, these are allowed throughout, not because they're the most important, or I want to get a haircut, or I think you deserve to get a tattoo during this pandemic. But this was an area that we were very nervous about in public health in May when we did our initial guidance. They often require very close contact face-to-face from the staff member providing the service and the client. But what we've seen in Oregon, as well as in other parts of the country, that with the use of masks, with increasing the distance between that staff and client pair and others, limiting the interactions to one person when at all possible, is that we have not seen significant spread in these settings, and so that's why they're allowed throughout. For retail stores, similar to the malls above, capacity is at 50%, and those with the highest spread, and gradually goes up to 75%. Social and at-home gathering sizes, both indoors and outdoors, are limited in those counties with the highest spread to 6 people, with a recommendation across 2 households, and those numbers gradually go up. What we're asking you and others to think about is all of those gatherings add up. So yes, you can get together with 6 people tonight and 6 people tomorrow and 6 people on Friday. But if those are 6 different people across different households, each of those opportunities for transmission increases. So trying to limit your kind of risk pool over time to a core group of friends and family, that you have some agreements about who they're hanging out with, who they're getting together with on a regular basis, can help limit the exposure overall and mean that you're less likely to bring the virus back home to your loved ones in your household or to others. Technology can be a way to augment this, but this is something you're in for a while. So with that, I want to transition to vaccines, since that's one of the ways we're going to get out of this. I put this website in. I'm not sure if the Spanish language translation is done, but if not, it will be up soon. We are very excited that the initial vaccines seem to have performed very well in their initial studies. Both Pfizer and Moderna, the 2 that are furthest along, use a new technology, relatively new technology for vaccines called messenger RNA technology. That messenger RNA is used to create a protein. That protein is on the spikes of the virus that you've seen in those pictures or drawings, and allows the body's immune response to react. Those vaccines have been shown to be very safe in their initial phase 1, 2, and 3 trials. That the side effects tend to be localized, redness, swelling, and pain, and then some systemic pain, some aches, some fatigue, and some other things. This isn't because someone is coming down with COVID. The vaccine doesn't contain the virus live or killed or attenuated. It contains those proteins, and those aches, that fatigue, is your body's immune system kind of responding to those proteins and creating the antibodies in the memory cells so that if you're exposed to the actual virus later, you can fight it off. The efficacy, how well it works, is much higher than we all thought it would be, or all hoped it would be, at around 95% for both vaccines. That's extremely high. Our seasonal flu vaccine can be between 60 and 70%, sometimes even lower if there's a poor match in terms of efficacy. So this is really great. You may have heard today that the British government kind of saw some reactions to the vaccine in people who had a history of serious allergies. And so they've recommended not giving to that. I think that'll be on the FDA and CDC's radar screen as they have committees reviewing those vaccines, I believe, tomorrow and over the weekend. The next vaccine that's in the pipeline has the AstraZeneca vaccine, has about a 70% effectiveness. And if you're saying, oh, well, I wouldn't want that, I want one of the 95% ones, keep in mind that that 75% effectiveness is still a very good vaccine, and we think it'll be a really great tool. We hope to get some more information as the data comes out from the FDA and the CDC to see if certain of these vaccines work better in certain segments of our population, older adults, those with weakened immune systems, so that we can target those vaccines. We know that distributing these vaccines, which are anticipated to arrive next week, will be some challenges with the first vaccine, the Pfizer vaccine, requiring especially cold storage, which there's limited capacity here in Oregon. So let me talk a little bit about these phases, knowing that this chart has updated a little bit. That initial vaccine that comes in that's going to be limited, the federal government has set some priorities for that Oregon is going to follow. They'll go to workers in healthcare settings. That's not just the physicians and nurses and respiratory therapists who provide direct care, but the others, the environmental staff, food service staff, and others who have contact with those patients over time in multiple contact. At the same time, added to that phase 1A group are residents and skilled nursing facilities. These are long-term care facilities with the highest level of care. So residents and staff in those facilities will be in this first priority. We've seen about half of our deaths in Oregon come out of congregate living facilities. We know this population is especially vulnerable, and as we work to protect hospital capacity and prevent death, that's a very important segment of the population. Skilled nursing facility residents and staff represent a small percentage of all congregate living facilities, which will be added on in later phases. The initial vaccine that we get in December, hopefully starting next week if the approval processes happen this week, and continuing weekly through thereafter, will likely take us, through January into February to get through this phase 1A piece before we move into the next piece. This includes essential workers. This is folks across certain social service agencies, utilities, food service, educational, a broad range of essential workers. We have a committee that is standing up here in Oregon with community members and healthcare partners who help prioritize within this group as limited vaccine will mean that not everyone can get vaccinated at once. There will also be the addition of those at severe risk of disease, older individuals, and those with underlying conditions during this phase 1B part where there's still limited vaccine. As vaccine continues to be more available, we will continue to try and vaccinate these folks, as well as expand vaccination into the general population, likely around the beginning of the second quarter of next year, with hopefully sufficient vaccine to vaccinate broad swaths of the population through the summer, so through the middle of next year. Most of these vaccines require a 2-dose series, and so we will hold back vaccines for that second dose so people can be fully protected. But even some of the data from the initial Pfizer trials have shown that after 1 dose of vaccine, there can be about a 50% protection, but that second dose brings it up to 95%. Also, what we know about these vaccines, they're very effective at preventing disease and serious disease. What we don't know yet is if they prevent you from getting an infection and being asymptomatic and transmitting it to others. We'll continue to monitor how these vaccines work and see if we can get a better handle on that after it's been given to more people. So with that, I'm a few minutes over, so I'm going to stop, and I think we'll start answering questions.
Thank you so much, Dr. Seidlinger. We have several questions in the queue. I'm just going to get right to it. First question, what capacity do our hospitals normally operate at?
I just answered that one in writing, but I will answer it in person. Typically around 90%. I was going to pick an easy one. Typically around 90%. Hospitals aren't in the business of having empty beds. The staffing is definitely pricey. So hospitals do operate near capacity, and we often run into problems during the winter every year when flu comes. But this year, what we're seeing is it's across the state. We can't rely on our neighbors as New York City did during their surge because they're all facing similar capacities. And hospitals are already kind of juggling, kind of canceling elective procedures to try and free up some beds. And what we're seeing this year that we don't typically see is a lot more of our healthcare providers being impacted by the virus and not being able to work.
Okay. I've heard this next question from several folks over the last week or so. So how is the regular flu doing this season? Not COVID, just your garden variety of flu. What are those numbers looking like this year?
So we've definitely seen flu in our community this year. What we saw when the flu vaccine became available, we saw an increased uptake of the flu vaccine. We don't know if that's people getting it earlier or new people getting the flu vaccine, but I would encourage everyone out there, if you haven't gotten your flu shot yet, get your flu shot. But what we also seem to be seeing, and what they saw in the Southern Hemisphere where winter is opposite from us, that the measures we're taking, using our mask, keeping our distance, limiting our gathering sizes, has impacted flu as well. So far it's been a milder season, but our flu typically peaks towards the end of the year, but more likely in the beginning of the year. So we can't let our guard down, and that's why I encourage you to get your flu shot if you haven't already.
Thank you. Interesting question from somebody regarding a gym that has rolling garage doors and can open an entire wall. Could it be considered outdoor? Or during this time, is there a minimum square footage that needs to be open for it to be considered outside? And what's the tent rule? How does that tent rule apply to gym? Or is it just ubiquitous? If you're a gym, you're closed down. What's the rule on that?
So I know we've had some guidance out there for outdoor dining, bars and restaurants, and I'm not sure if the guidance is promulgated across all sectors, so I'll have to look into that.
Okay.
But the guidance that we had up before this risk level guidance really says that for 75% of the walls should be open to really be considered outdoors. It's those 3/4 that really offer some airflow. We know we've seen some really amazing, dramatic structures that restaurants and bars have built, but some of those kind of go against the kind of the reason for having outdoor services being allowed. We want the air to flow through. We know that it's not ideal in much of Oregon through the winter. We can do some things with heating and a roof, but with 75% of walls open, that breeze can really make it not as pleasant, but that's what really allows us to lower the risk, especially in places where the masks may not be as effective, whether it's because you can't wear them when you're eating or in the gym where they're not as effective. But I think one wall that rolls up is great. So when you're allowed to do indoor activities, trying to keep that wall open and keep some airflow in is great. It can lower the risk indoors, but that would not be considered an outdoor piece. And the tents, again, it's 75%. So I think I got all those.
Yep. Thank you. Has there been any discussion of when teachers will be vaccinated on the year level?
So broadly, teachers would be considered essential workers in the education setting, and there certainly has been some talk of where would they fall in that piece. Would they be early on so that we can really try and offer them the protection to lower the risk even more in schools, as we know how important it is to get kids back to school, but that decision hasn't been made. Let me talk about schools a little bit. I think we know that the impact on children and families has been huge. The impact on the workforce from parents having to juggle being a parent, being a teacher, and being a worker all at the same time from their home has been challenging. So we really want to try and get kids back into a level of in-person instruction as quickly as possible. We know comprehensive distance learning has worked tremendously well for some families, some students, and some staff, with teachers talking about the connections they're able to make through comprehensive distance learning that they were never able to make before. But we know it doesn't work for everyone, so trying to have that option available to everyone is important. So whatever we can do to lower transmission in the community helps, and then the Ready School Safe Learners guidance really lowers risk of transmission once they're in school, and the vaccine offers another level of protection.
Yeah. So what percentage of the population needs to get this vaccine before we get herd immunity and consider ourselves somewhat close to approaching a new normal?
Most of the ranges I've heard based on the effective reproductive number, meaning how many people are infected by someone from this virus without any other measures in place, range from about 70% up to over 90%. So that 70% seems to be a fairly consistent piece. I think the thing we have to remember is the vaccine will come in limited quantities, and we won't have enough to vaccinate everyone all at once. So it's going to take some time to build that up. And we know there's some skepticism because of how quickly the vaccine came out. So even though it's called Operation Warp Speed, the Warp Speed didn't take out the study pieces. The safety and efficacy studies that were done followed the usual studies, but some of the administrative burdens and other pieces is where the speed up came in. So for Pfizer and Moderna and several of the others who don't even have approval for their vaccine yet, they've manufactured a significant amount, and that's ready to be deployed once the vaccine is approved rather than in a stepwise fashion. We also have to remember that studies right now are just starting in children. So from that 70%, children aren't eligible for the vaccine right now. We anticipate the CDC may allow approval down to 16, but the vaccine hasn't been studied in younger children. And so that will roll out later in 2021.
Thank you. Has the quarantine guidance reduced to a max of 10 days from 14 days? Is that pretty much a done deal now? the reduction?
We are rolling out guidance that will align with the CDC, and I'm not sure if it's been posted yet. 14 days is still safest, but what the studies have shown that in that last 4 days, there's really a significant reduction in the ability for someone to come down with the virus. We're in the process of updating that guidance to say that with rare exceptions, those exceptions being association with an outbreak in a congregate living facility and maybe in childcare, that if someone is without symptoms, continues without symptoms for 10 days, that they could end their quarantine at 10 days. That folks without symptoms, not in one of those settings, who has a test, I believe, at 5 to 7 days that is negative, they could come out of quarantine at 7 days. We think this will significantly improve compliance with quarantine and also get people back to work or back to school sooner with a very minimal increase in risk of transmission. So those guidance and then the cascading inclusion in other guidance and OSHA documents is happening this week.
Thank you. So I'm glad somebody asked this. It was on my list to ask you if somebody didn't. So what long-term, as much as you can tell or understand, will COVID look like? We know that every year the scientists come out with a new flu vaccine based on predictive data. And so is that a similar situation with COVID? Will it change every year? Will we have to do this every year?
This doesn't appear to be like influenza that has multiple strains that are very different. And these initial vaccines have targeted the protein. That protein has stayed fairly consistent over time. And we have not seen significant drift in this virus. Early on, we did see some changes and some divergence in some strains that were much more transmissible, meaning it was easier to pass from one person to another. But overall, the genetic makeup, the proteins on the outer part of the vaccine haven't changed that much. And so we think that this vaccine is going to remain effective and not need to be changed every year. We also don't know if this is a vaccine that we can get once or twice with the 2 doses and how long that immunity will last, or if it'll be an annual thing. So far with natural infection, what we've seen is a fairly lengthy period of circulating antibodies, but more importantly, those memory cells that remain, even if they don't see the antibody in the blood, those memory cells are still there. And we think that the vaccine is going to provide a similar kind of length of protection. But as more people get vaccinated and more people have been vaccinated for longer, we'll be able to see that. So time will tell if we'll need another vaccine next year, the same vaccine or a different vaccine. But I think it's going to be several years before you need another vaccine, and it may be the same vaccine.
Okay, that's fascinating. So, Dr. Seiler, how often do you and the governor and the team working on this evaluate the metrics for each category, for the risk category? In other words, is this a weekly process? And because obviously a lot of people are wanting to get their doors open again and to survive, their businesses survive. So what does the evaluation process look like? How often does that happen to update the categories?
Well, in terms of updating the actual framework and that, I think we'll commit to look at data research and things that we learn in Oregon and from other states and other countries about the spread of the disease. And if we see major changes, to update that framework overall. The framework just went into effect last week. Was it just last week? I think so. I lose track of time during COVID. What we'll do is we will pull the data at the beginning of every week. So we look at a look back of 2 weeks from a beginning on a Sunday, ending through a Saturday over a 2-week period. For communities such as Deschutes with a population of over 30,000, it's the rate per 100,000 over those 2 weeks and the percent positivity. If one of those puts you into a higher risk level, you fall into the higher risk level until both come down lower. While the data gets pulled every week, it's acted on every other week. So there's a warning week where we pull the data and it says, hey, you're going up or you're going down. We're going to look at this again next week when we pull the data. And if that trend continues, then you will be moved at the end of the week. So every week you'll see data. 1 week it'll be a warning. It'll be posted. The raw data is posted on Monday. It used to be called the school metrics data. It's the same data. We're going to name that more broadly. have a pretty picture of the visualization with the map will likely be updated Tuesday or Wednesday. And then the next week when the data is pulled, when it's a movement week, we'll look at the data from the previous 2-week period, and if that shows a county would move and risk, county leaders will be notified, business owners, citizens can see what that data is, and then those would go into effect at the end of the week.
Okay, thank you. And Emily, we haven't been ignoring you. I know you're there. And I don't know who can answer this, but and whether it's answerable. But what happens if this vaccine comes out and you're an employer and you have an employee that refuses to take it? Is there some sort of guidelines or risk or as an employer responsibility on this end? Or is it just strictly like any other vaccine and it is an individual choice?
I will say I'll start that because I don't know that
Okay.
Emily will have amazing things to say about that, but she's welcome to add in. I think, what we would say is it is like any other vaccine. And so, kind of look at your own situation and really seriously consider whether a requirement is the right way to go. What's going to be a little different about this vaccine is it is a new vaccine. Again, the studies have not been rushed, and that shows really good safety and really good efficacy. But it will likely be approved under an emergency use authorization while the ongoing studies continue. That means that technically it would be what's considered an experimental drug. So I think, requiring that within a larger system is probably more difficult than another vaccine that's been around for a decade or more. So certainly whatever you can do to link folks to appropriate resources to get information about that vaccine, to facilitate access of your staff to getting vaccine, I think would be really important. But the requirement piece is not something that's going to come from the state at this time, from the federal government. But, as an employer, can look at what your HR policies are and what your legal counsel says to see if that's an option for you.
Okay.
I'm not a lawyer. I don't play one on TV, so that was not legal advice.
Excellent. You did great. Emily, did you have anything to add to that?
No, I would just echo the same thing. It's probably an individual choice. I'm going to guess if people have questions, what's going to come up is I have some staff that are vaccinated, some that aren't, and now I have a COVID case, and how do I handle that?
Right.
And I imagine that when that happens, when we get to that point, there'll be more information to help assess risk in that way to say, these people, if they aren't vaccinated, this is how we're going to handle that exposure. These people that are vaccinated, this is how we handle those exposures. So I'm going to guess that would be a huge question for the employers, and we'll have to see what comes out, but probably between us and OHA, there'll be information on how to assess that risk.
Great.
Totally agree.
Yeah, there's so much more to talk about. I really appreciate both of you being here, Dr. Dean Seidlinger and Emily Freeland. Thanks for joining us. And a reminder to everybody, this will be available on YouTube and on our website, and all the materials that were included in the presentations as well. I really appreciate everybody joining us today. Hopeful news, but vigilance is key in getting us through this last hump over the last few months. And hopefully this time next year, we'll all be together and in a new world. Appreciate everybody joining. Happy holidays. Please follow the guidelines, wear masks, distance, wash your hands, shop local, and in as much as you can, enjoy your family and a restful holiday season. Thanks everyone for joining us.